My name is Lynn Allgrant, and I am a member of the City Council in Englewood, New Jersey. And I welcome you to this very important event to learn about the Patient Protection and Affordable Care Act. Healthcare is so vitally important to our community and to everyone. And it's extremely important that people have the information they need to begin to sign up for healthcare, for the tax credits and subsidies that they may qualify for when the Affordable Care Act kicks off on October 1st.
The day the Affordable Care Act passed, I got to the chamber 4 hours early. And I got there 4 hours early because I didn't want to miss that vote. And I said, Lord, I only had one prayer. Being the son of two preachers, I do pray. I said, Lord, don't let me die before I vote for this bill. And I meant that. Because it is so very, very important, because so many people are dying early and suffering needlessly, Reverend Miles, and this law will make a major difference.
Is to address you as faith leaders, and whether you've been beneath the cross, bow before the Star of David, kiss the black stone of Mecca, or simply stand before the infinite is and proclaim how great thou art. We have a unique responsibility as faith leaders in this state to make people aware of the Affordable Care Act. Now, why should we as faith leaders be involved? First of all, it's the morally right thing to do. We are challenged to do justice, to love mercy, and to walk humbly with God. And whenever there are people who are being locked out of a system so vital to their existence, faith leaders, regardless of their creed, ought to stand together to say that this shall not be in the state of Maryland. We should be involved intimately because this is the morally right thing to do. Secondly, it's because health issues affect all of us. It doesn't matter what your faith is. You need adequate health care and adequate health care coverage. So it's a health issue that affects us all. And it is a social justice issue that challenges all of us to stand on the side of right, to stand and speak for those who may not be empowered to speak for themselves. But we ought most importantly be involved because we have access to the most people on the most consistent basis of any leaders in the state, in the nation, in the world. I don't know any politician who could get someone to come every Sunday and listen to them talk. I don't know any corporate leader who could get a crowd to come unless paid to listen to them talk. But we have a captive audience week after week, and we ought to avail ourselves of the opportunity to disseminate the kind of information that's needed so that people can stay healthy. And I've come to discover that God doesn't ask us to be the best, to be the brightest. He doesn't call us to be the most powerful. He just challenges us to show up and make ourselves available. So faith leaders, I challenge you to show up as Noah did, to build an ark. To show up as David did, to go down into the valley to fight a giant named Goliath. To show up as Isaiah did when he saw the Lord high and lifted up. To show up as Jesus did for a day on a cross at Calvary. And if we show up, God will show off. Amen.
So today we wanted to convene ethnic media throughout New York City in one gathering to come together and talk about the Affordable Care Act and what it means for New York. So we had panelists to give an overview, and then somebody from the Department of Health who's managing and implementing the plan for the health insurance exchange in New York to really speak to where they are in the plans for building an exchange. And we had other child health advocates and health advocates from different communities to speak about the importance and relevance of cultural linguistic competence and outreach.
It's a very exciting time in New York. Starting in October, the Affordable Care Act will really come online for people, and suddenly for the first time people will have a meaningful health insurance options, and they'll be able to go to these things called exchanges, which are online marketplaces, and they'll be able to do an apples to apples comparison to be able to see what kind of insurance options there are. If they're very low income, they'll be able to enroll in public health coverage for free. And if they're sort of more moderate income, they'll be able to get federal financial assistance called tax credits and be able to put that forward to buying low cost or free health insurance.
New York is, as you know, it's a very diverse city, from New York City to the suburban counties to upstate. And I think it's really essential that we get the word out that this is something that's going to benefit so many different types of communities. And one way that we can really do that is think of like a grassroots movement and involve different sectors of our community, whether it be faith-based organization, community groups, the media, small businesses. It's really going to be an effort from all of us to make sure that the larger community gets to know and benefit from the health benefit exchange.
This is the mother of all matters. There's no matter that is more important than the healthcare matter to my community. In fact, we can't wait for September. We have to start tomorrow, because healthcare decisions are so important. People have to have access to the information now so that they can make spending and budget decisions next time around. So they have to know that this is what will be available to them 6 or 7 months from now. They need to do that now, so it is that important.
This issue is deeply personal to me. In 1998, I was executive director of a small nonprofit organization, and one of my colleagues and staff members, a young man in his 20s, was diagnosed as HIV positive while he was working for me. I was fortunate in my organization, although we were struggling, to provide health coverage for my staff. For my employee, at that time in his life, he needed to stop working for a while and get his health together. And one of the things that I wrestled with, quite honestly, was I knew that if ever his health coverage lapsed, he would be a person with a pre-existing condition and would never be able to get health care again. And so in my struggling organization, at a time when I couldn't always make payroll, I paid his health care premiums for 7 months to ensure that he had continuous health coverage until he was well enough to get a new job and to get health care. I'm happy to say that he is healthy and happy and doing great work with young people right now in Maryland. But I was at a point when the moral thing to do was to make sure that he had health coverage, because I would never have wanted to be responsible for someone to be a pre-existing condition person who couldn't get health coverage. The Patient Protection and Affordable Care Act is going to ensure that that never happens to another person ever again. No employer will ever have to decide between the fate of their agency and the right way to spend their money and doing the moral thing for a person that they care about. No person will ever have to worry again about having a pre-existing condition and no longer qualifying for insurance. The Affordable Care Act is a monumental change in our lives, but it's only going to work if people sign up. So we need to get the information out there. We need to let people know how they can access the information, what they will qualify for, and how to sign up. I thank you for coming here tonight to learn about this important event, and I encourage you to tell everyone you know, whether they're strangers or friends or family, that they need to make sure that they have health insurance and that there's information out there to help them do it. Thank you.